Welcome to Washington Hospital Today, the program dedicated to sharing timely information about the community hospital that's been taking care of Washington Township Healthcare District residents since it opened in 1958. Washington Hospital Today is provided for the sole purpose of informing residents about healthcare topics and issues that have been covered during community forums, free health and wellness classes, or as part of educational sessions held during the district's open board meetings. This program is one more way that Washington Hospital helps empower you, the residents of the district, by providing information needed to make informed decisions about your health.
Today's presenter is Sharmi Mukherjee. Sharmi Mukherjee graduated with her bachelor's in physical therapy from India. She completed her master's in physical therapy from Loma Linda University and earned a doctorate of physical therapy from Northeastern University. Sharmi is certified in vestibular rehabilitation by the American Institute of Balance and has been working with patients with dizziness, vertigo, and post-concussion problems. She has been a practicing physical therapist in the U.S. since 2007.
I'm glad you guys are here, and I'm going to try and give you as much as information I can. And hopefully, by the time you're done today, I have convinced you guys that running is actually good for you. But if done right. All right. Running is still, and was back in the day, one of the most popular activities for individuals to obtain fitness. It's very easy. You basically grab your shoes, get your headphones, get out the door. You don't have to wait for anybody, it doesn't have to be regimented, and it's convenient. Track and field athletics were included in the Olympics in 1896. That's how back running goes. And obviously it's still present. In 1928 Olympics is when women were actually first allowed to participate in the field track events. Most common fears amongst runners has been and will be injuries. And hence, I want to discuss some of the common injuries that we see on a daily basis and we are scared of getting injured. Approximately 61% of running injuries are reported of course, lumbopelvic area, hip, knee, and ankle. Hence, your common issues that you see on a day-to-day basis is low back pain, knee pain, hip pain, ankle, and sometimes shoulder and neck. Low back pain. It's common. Most patients complain of back pain after running, and as this progresses, it actually starts when you're running, and eventually it keeps getting worse, causing pain with prolonged standing, sitting, walking, etc. So you want to address this in the beginning. You want to start working on fixing the problem before it actually aggravates. The most common examples of back injuries or why they happen is muscle spasms because of lack of warm-ups, and I know this is fairly common. Herniated disc from excessive rotation, so if you have excessive upper body movement, low back movement, you're causing a lot of rotation in your spine, that will cause some degeneration and back pain. And then you have upper back sprain due to improper arm swinging. Now, if you're swinging it too much, like in the picture, or if you have an incorrect running technique, that'll definitely cause back pain. I'm just going to go over a little bit of anatomy over here. On the left-hand side picture, you can see the huge muscle called the gluteus maximus. See how significantly large that muscle is compared to the rest of the muscles in the leg? Hence, obviously, the name. But that is your butt muscle, basically, and that needs a lot of strengthening, and a lot of push-off comes from the glutes when you're actually running, and hence strengthening that muscle becomes extremely important. Then you have the small, tiny muscles, again, on the left-hand side picture. You have the semitendinosus, the biceps femoris, and the membranosus. These three actually form your hamstrings. And again, hamstring tightness is one of the most common issues with most runners because of lack of stretching. And then we have the most popular one, the IT band. It starts from the hip and goes all the way down to the knee. And as you can see, the color is different. It's white and not red. It's actually more of a tendon than a muscle, and hence it's actually really difficult to stretch that. It's notorious for getting tight. Now, since that muscle starts from the hip and goes all the way down to the knee, it can actually trigger hip, knee, or both body parts giving problems. IT band tightness gives us a lot of challenge in actually diagnosing knee issues because sometimes that is the main problem. So this is a little bit of anatomy of the knee that I want to go through. You have the quads, that's your main knee muscle. Then you have the kneecap, that's the patella. The kneecap then inserts down along the leg with the tendon, that's the patella tendon, and then you actually have the 3 hamstrings that we saw in the previous slide attached over here. So hamstring tightness, iliotibial band tightness can give you serious knee issues. So IT band syndrome, we just went over the IT band. It starts from the hip, goes all the way to the knee. If it's tight, you will have knee issues, you will have hip issues. Then we have the hamstring tendinosis. Hamstrings are tight, they will suffer. At some point, they will either cramp up or give out or have small ruptures. Femoral stress fracture, it's not very common. However, it starts or presents itself as hip pain. So people usually tend to ignore it. But if it prolongs for a long time, make sure you go in and see a doctor. It could also be excessive training, vitamin D deficiency, muscular imbalance, lack of strengthening. Then you have trochanteric bursitis, which is basically, again, the hip area. It's basically the TFL or the IT band rubbing against the hip joint, causing some inflammation. Labral tears are not very common amongst runners unless you've actually had a fall, twisted your ankle, or turned, stepped off a curb in a weird way. With labral tears, again, it's not always, but most likely patients know that something went wrong. So you will feel it right away. You have the patellofemoral syndrome, which is coming from the knee problem, and then you have the tendinopathy. These are your common hip and knee injuries that we see on a regular day-to-day basis. Then, of course, you have the ankle and the foot. 16.9% of most overuse injuries are of the foot and the ankle. So you have the Achilles tendinopathy, peroneal tendinopathy, plantar fasciitis, and tibial stress fracture. So Achilles tendon, I think everybody knows, runs from the back of the heel. And if your ankle is not strong enough, if you're running on uneven terrain, you will start having problems if you're not doing enough or long enough stretches. Then you have the peroneal tendinopathy. Peroneal muscles are on the outside of the leg. Again, not stretching or doing enough warm-ups will give you pain around that area and give you some shin pain. Plantar fasciitis is fairly common amongst runners who basically have a little bit of a dropped arch or flat foot, what they call, because that fascia is constantly getting pushed down or overpronating when you're running. So that could irritate the fascia. So important thing over there is shoes. You have to have the right shoes. Tibial stress fractures, again, not super common, but deficiency, overuse, excessive training, all of that could definitely cause some tibial stress fractures. I just wanted to share the anatomy showing how the lumbar spine is attached to the hip, is attached to the knee, is attached to the ankle. So if anything in this chain is thrown off, you will feel it. Even if it's a back issue, it could develop as a hip problem. A hip problem could develop as a knee problem. So if you come to a therapist or go see a doctor presenting with knee pain, your problem might actually be coming from the hip. So it's a very much kinetic chain reaction. So if you have any aches and pains that last for too long, I would recommend seeing a doctor. In order to be a runner, you have to be mentally tough. So you can push through a lot. Runners have very high pain threshold. But if you see something persisting for a long time and not going away, there is probably a biomechanical change that needs to occur. So make sure you see an expert, either your doctor or a therapist, whoever you need to. Nothing should last for a long time. Nothing should become chronic. This is Meb. He's our 2014 Boston Marathon runner. I put this picture because his stride is perfect. So this is something most runners talk about, terrains. And it's very important. You need to know what terrain to run on, what is okay for you, what is not, and what we should do about it. So I just want to go over some basics. So first is grass. Grass is extremely soft, and it's easy on the lower extremity in terms of impact, because it's soft. Flat grasslands provide excellent surface for speed work. However, most of them are uneven and can pose dangers to runners with weak ankles, especially if you're not expecting a dip or a little bit of a bump. Your ankle will twist, so be careful. Also, when it is wet, it is extremely slippery, so please be mindful when you're running on grass. Woodland trails, of course, they provide the scenic advantage. I mean, you're running outdoors, you want to be outdoors and, find something good to look at. So it's good motivation. They have soft peat that helps keep the impact low. However, most of the times the trails are muddy and slippery, so again, be very careful. The treadmill. And most runners do not like the treadmill. They think it's boring, which is okay, I understand. It can be, however, ideal for speed work because what you're doing is you're controlling your environment. You're controlling the speed, you're controlling the incline. It's soft, you have no dogs running after you, there is no fear of falling. So it's very controlled. Smooth surface makes it easy on the legs, also helps you be more aware of the impact. So if you can hear yourself pounding on the treadmill, you need to change the way you're landing. That means there is a problem with the landing technique. It has to be soft. When you're on the treadmill, you should not be able to hear your footsteps. So it's a good way of actually checking our self-correction. Plus, when the weather is outside, you don't really have an excuse. You can go to the treadmill. Then you have the synthetic track. It's actually pretty good. The track these days, they provide a forgiving surface. Also, the distance is very exact, so you know how much you can go. However, the turns are very steep, so make sure you don't do any long distance running on tracks because the hips and knees will start giving you problems on the curves. So do speed work, that's fine, and keep the distance very short. They're very nice and soft, so you have this little bounciness to it. Then concrete, ugh. The binder is cement, which is really hard for your joints. However, that's pretty much the most common running path that's available freely everywhere. So as much as possible, avoid. I'm not saying it's absolutely bad and you shouldn't do it. Avoid as much as possible. Maybe don't do long runs on concrete. But in comparison, it is a little bit on the tougher side for the joints. Then you have sand. Sand really provides a lot of challenge to the ankle and the lower extremity. It gives your calf muscles a really tough workout since the surface is so uneven. To be safe, avoid excessive unevenness, stay along the water. And then just for fun, I just put snow in there. It can be very challenging. It's different. It gives you a sense of adventure, but be careful. Please be smart about it. Don't slip. Just slow down a little. Is running good for you? Is it good for your joints? Is it good for you? I don't know. Let's see. Let's try. Improves cardiovascular capability, improves balance, improves musculoskeletal endurance, improves cognitive function, increases overall endurance and strength. I think that's a pretty good reason to start running, right? Or at least keep running. Don't you get arthritis if you run for too long? And my answer is always no, but I thought I would give you guys some solid examples from research that has been done to show you that actually there is no link between running and arthritis. So the first one is physical disability in older runners. It was done by these 3 scientists. So what they did is they picked 454 runners, age 50 and above, and 292 non-runners around the same age. They checked them annually over 5 to 7 years by mailing them questionnaire. What they realized is only 49% of the runners reported some physical disability during the study, whereas 77% of the non-runners reported more physical disability. I mean, the comparison is huge. So the conclusion was arthritis symptoms were present in the runners and non-runners, so it had nothing to do with running. The running and development of disability with age, this was done over a period of 8 years. They had 534 runners and 227 non-runners. And the conclusion was older persons who engage in vigorous running and other aerobic activities have lower mortality and slower development of disability than do the members of the general population. I mean, that's huge. That's a significant number and a significant conclusion. And the last one, reduced disability and mortality among aging runners, a 21-year study. I mean, that's a long time. The conclusion was vigorous exercise at middle and older ages is associated with reduced disability in later life and a notable survival advantage. I think these 3 researches were huge and tells you that arthritis and running are not necessarily related, for sure. If you go to the shoe stores here, They're actually pretty good about suggesting the right type of shoes. Most shoe stores will, like Roadrunner for example, they're in San Carlos and I think they have one in the East Bay. They will get you on the treadmill, bare feet, and you basically run for a certain time. They record how you're running to make sure they know how you're landing, etc. Then they'll get you on a balance board just to check how you're putting your weight, which section of the foot you're putting your weight, and then they'll give you recommendations. They also recommend orthotics, which is not necessarily always accurate, talking from personal experience. However, their shoe recommendations are fairly good. So neutral supportive is something that most are recommended clinically. What you want to do is with low arched people, you want to give them motion control, because with people who don't have good arches tend to overpronate, and you don't want that overpronation because the knees will get affected. For people with high arches, you want to give them the cushion ones to support the arch because their arch is so rigid during running. So shoes are very important actually, so make sure you guys have good shoes when running. All right, Meb, again the 2014 Boston Marathon runner, in his book he mentions that he actually doesn't know of any elite runner who runs barefoot on hard surfaces. That's actually not very smart. He does it occasionally, he says in his book, on soft grass for speed work and for intrinsic muscle strengthening of the feet and to make sure he lands correctly, but he doesn't go long distance with barefoot. You need to strengthen your intrinsic muscles. I mean, this has been a hot topic for quite some time now amongst runners, and I think people who've been running barefoot eventually have gone back to wearing shoes, because what happens is your muscles are not trained to do that much work, and you suddenly go from wearing shoes to running barefoot. You land up with injuries that your body is not used to handling, and basically you develop blisters, tendon injuries, metatarsalgia, sometimes even fractures. So if you've been running barefoot since you're 5, that's fine. Go for it, keep doing it. But if you've been running with shoes all your life and suddenly switch to barefoot, that is probably not super smart. So you want to gradually get into it, not go from shoes to no shoes. So if that's something you want, maybe you should start training on your intrinsic muscles, strengthen the feet, start slow, and then see how the body handles it. Some common differences between male versus female runners. So women have structural differences. We have wider pelvis, we have increased Q angle leading to hip rotation, foot pronation, knee valgus. Studies showing females demonstrate 11 degrees more knock knees as compared to men. So you see how the knees are going inside? That's called knock knees. And that's coming from the wider pelvis. There are hormonal and neuromuscular differences too. Hormonal androgens, that are necessary hormone for muscular formation and strength, are released lesser amounts in females than men. And estrogen, on the other hand, is released excessively in females. That creates greater body fat percentage. And then you have neuromuscular. Due to estrogen production, females tend to present with more ligament laxity, thereby leading to increased possibility of injuries. Because if your ligaments are excessively lax, you're more prone to injuries because you're not stable. Then you have injury percentage between genders, just to show the difference. Patellofemoral syndrome, 62% females have it versus 32% males. I mean, that's pretty significant. Then iliotibial band, again, 62% females versus 32% males. Sacroiliac injuries, which is the pelvis area, 91% females versus 9% males. So we need to work hard on strengthening. However, we can avoid injuries. So injury prevention and physical therapy, dynamic warm-ups. We're going to demo some of these. Post-running stretches, very important. Then we have circuit training. You need to cross-train, basically. That's the goal. So do yoga, do boot camp, do Zumba, do spin, do CrossFit, do whatever it takes to do cross-training. That's the goal. So you want to spend 3 to 5 minutes before running on doing the dynamic warm-ups. Traditional stretches were done in the past, but now what they're saying is if you do a static traditional stretch for a long time, your body actually is getting prepared to relax. So after doing a static stretch for a long time, if you go to run, you're actually more prone to injury. So what they're saying, and they have enough study on this, that you want to do a warm-up while you're in movement, and hence dynamic warm-up. You don't want to do a static stretch before. You do a static stretch after to relax and get the circulation going, but you don't want to do a static stretch before. In fact, they have compared injuries to see, and they have noted that, you know, people who do static stretches are more prone to injuries because their body is not ready to just get up and go. It learns to relax. So we're going to start with the Frankenstein walk. So the goal is to stretch the hamstring. That's the goal here. But you're stretching the hamstring while you're walking, and she's doing it perfectly because I've trained her. No, I'm just kidding. The back has to be straight. Go ahead and exaggerate the back a little bit. You know how you were doing it? Like do that. Yeah. So you don't want to do that the back thrust movement. The goal is to stretch the hamstring. So your back is going to be straight, and you're just going to pull the leg up. The hand is just to give you an idea how high you can go. Again, the goal is not to go super high, just go as far as your body lets you. We have the high knees. There we go. And turn around, let's do the butt kicks. Hands at the back. There we go. And the high knees one more time. Very nice. And the butt kicks one more time. So a few pointers when you're doing high knees. Just make sure you're not going forward, okay? Your body has to go a little bit at the back like she demoed. So you have to actually see how high you can go up, okay? And the butt kicks, make sure as she demoed, the ankle is actually moving towards the butt. It's not just the knee, it's the ankle too. You're preparing your whole body. So make sure the ankle is actually going towards the hand. You want to do maybe 30 feet, just back and forth, once or twice. Again, 3 to 5 minutes should be your total stretching time. Just jumping jacks, just maybe 10 or 15, doesn't have to be too many. And then the single leg hop, let's see. There we go, higher, step hop, higher, step hop, step hop, step hop. The goal for this is preparing yourself for the landing movement, okay? So you really want to be able to go as high as you can. So you want to use the ankle to propel yourself off the floor. Pretend like you're reaching for something in the sky. So you want to use your hands in order to be able to push off, push off, push off. So you want to actually do that hop or that jump. The other thing is when you're landing with the hop, so it's very easy to go, that hurt. You don't want to do that. You always want to land soft. You want to land soft. You want to do a midfoot landing as opposed to a toe or a heel landing. So these small things actually make a lot of difference. You don't need the cones when you do this. You're just going to go from side to side. Touch, feet apart when you're touching. There we go. Feet apart. That's good. Stay on toes, okay? No stomping. You want to go soft on toes, stop. Soft on toes, stop. You're doing a side-to-side movement here, okay? Then you have the walking lunge. You got this. You did. You take longer steps, a little bit. I just want to show the difference. It's pretty good, actually. Very nice. As you get better with this, you might want to just walk through rather than come back. And once this gets easier, walk back, walk back, walk back. Very important with lunges, this knee. You don't want to go there. You will definitely develop knee issues. You want to stay at 90 and drop down. The karaoke drill. Oh, we just did that today. There we go. You got it. One more. Then you have the heel walking. It does not mean walking on heels, so I just put that picture. Back straight. Try not to. There we go. Faster. Very nice. And now walking on toes, you know, like you're a ballerina. See? Back straight. Perfect. So that's your dynamic warm-ups. In short, those 7 or 8 exercises that we gave, make sure you spend some time before, always before. It doesn't have to be too long, just this much area. Just spend some time, even if you're in the gym or going on the treadmill, you know, it'll just take you a few minutes. Just warm up, prepare your body before you go ahead and start running. Now we come to the post-running, stretching, which is also important. I know it's very easy to get done with running and not stretch after all. Very important to cool down, stretch the muscles after a run. Also makes you less prone to injury, improves circulation. Main muscles to focus are your hamstrings, quad, and your calves. Use a foam roll stretch or a stretch belt. So we'll do some foam roll stretching demos here too. What is static stretching? It's basically defined as a stretch where you're holding the stretch position for 30 seconds to 2 minutes. Goal is to elongate the muscle to improve flexibility. Static stretches help reduce injury by maximizing flexibility and improving biomechanics, which we just discussed. So how would you do your quad stretch? So she's going to go on her elbows. All her weight is basically on the foam roll, just like the picture. You're just rolling back and forth. You need to have a little bit of upper body strength over here. So if you have, shoulder pain, I would say stay away from it. IT band. Yep, on your elbow. Perfect. And just roll up and down. Perfect. You need to stretch the IT band. I mean, that's a culprit, huge one. Either hip or knee. Next we have for the upper body, just to stretch the pecs. So you always want to do the pec stretch just to open up the chest a little bit. And it opens up the spine too. So these are called snow angels. All right, Lucy, can we do the upper back? Perfect. So heel. Just roll on your heel. Yeah, there you go. Hands behind the neck to support the neck. Perfect. Then let's do the hamstring. There you go. And up. There we go. Nice. Breathe. And up. That's it. Now let's go lower down. Yeah. Perfect. If it's too much to do both, what you can do is bend one knee. There we go. Lift the hip up and go up and down. Because sometimes it might be too much for the upper body, to both legs. So bend the other leg, just do one at a time, that's fine too. You're going to get a lot of stretch from that. Cross training, when I say cross training, I mean yoga, high intensity interval training, CrossFit, boot camp, and spin. They are all very good options for cross training because, as I said, you don't just want to log miles. You actually want your body to be ready to log miles. So make sure you cross train. The goal being to strengthen your extensor muscles. So your upper back, shoulder blade, glutes, hamstrings, and calves, all the back muscles. Because when you're running, you actually need your extensor muscles to propel you forward. You don't just want to use the muscles in the front. You want the back muscles to force you forward so running becomes less of an effort. Let me just give you a little bit of background on what happens when you actually come see us in physical therapy. We basically evaluate the running mechanics on the treadmill, primarily which shoes and which shoes that you use for running. Then we'll evaluate the striding technique at different angles from the side, from the back. Check muscle strength, upper and lower, because they're both important. You can't have weak upper body and strong lower body and not have effects. You will definitely have some kind of an imbalance because of that. Check shoe type, provide recommendations for sure, and possibly make changes in gait mechanics and focus on improving the imbalance that you have to make sure you're pain-free. Every patient is different, but the basic things that you're looking at is this. However, once you come in with a specific injury or a specific body part, there is a lot more detailed assessment that goes into that. So if it is an ankle, we'll go more into that. We'll see the whole kinetic chain, where it's coming from. Is it the back that's bothering the hip, etc. So this is just an outline so you know what to expect if you do come see us. Get in shape to run. Don't run to get in shape, because you want to be strong enough in order to run. If you're not strong enough to run, you will land up with injuries. So you have to make sure you cross-train. This is our address and the phone number. And I think that concludes my talk today.